The governing body over all the chartered physiotherapists in the UK is the Chartered Society of Physiotherapy. Karen Middleton, who is the chief executive of that society. Underneath the umbrella of the Chartered Society, there are several what we call professional networks, sort of subgroups, and they might be representing physiotherapists that work in neurology, say, or paediatrics. And Physio First is a professional network which represents self-employed private physiotherapists. From the Physio First perspective, working in private practice can be, a little bit isolating. We know that we have up to just under 3,000 members in the UK, all working privately, and it can be sometimes isolating. So Physio First was set up to represent the needs of those people working as self-employed private physiotherapists. And obviously the Chartered Society represents all of us physiotherapists, but the vast majority work in the NHS.
Yes.
And in the National Health Service, there's a lot of pressure on service. We know that, demand outstrips supply.
Yes.
And so physiotherapists have to work smart. And we're all looking for evidence of what works and what doesn't work. And so sometimes the National Health Service physiotherapists will perform a triage service. That's different usually to what happens in private practice, because our members see patients as they come through the door and in effect work in the same way as what's called a first contact practitioner would, because they have to assess, use their clinical reasoning, decide on the best course of treatment for the patient, and then treat them to discharge.
Yes.
Or refer them on if necessary for scan or further investigation or whatever it might be. So I think that's a big difference. We have the luxury of more time with the patient, and so can be more expansive perhaps in the treatment that we do.